sending a signal that I don't think we're trying hard enough to make sure that I think mental health is getting a disproportionate amount of the cuts. And I don't think we're trying hard enough to realize that there are cuts and there are cuts, okay? And I think mental health has taken a disproportionate amount of cuts, and that there's certain things you can't cut as much as others. That's what I'm telling you. And I've stayed quiet because I thought it would take care of itself, but I don't think it has. So you can write that any way you want. I think it has had they've been too severe cuts. I think that it's one thing when you reach a certain level of stability, whether it's a relationship or you're building a building, you're okay. You're not going to go backwards. You can't make cuts in mental health without going backwards. That's the problem. You're going to go backwards because we're still not there. We still whisper about mental health. We still don't talk openly about mental health. We still hide mental illness disease. So right off the bat, it's very easy when you start to reduce mental health programs or not funding to the extent we said we would with this 6-year program. You're losing sight of where you are with mental illness. And this budget has lost sight of where we are with mental illness. So I said it, but the more I could only take it so long until I realized what the priorities were for different major legislators are coming up with different things they want if we can get more revenue. Not one of them has said mental health. Not one of them has talked mental health. Nobody. So I got angry. I just got angry and said, well, Peter, you better start talking about it. Because we got an economic forecast coming out. I don't know how much it's going to be. But you know what I mean? And we're struggling. We got the provider tax, which we haven't voted on yet. You know what I'm saying? So, Peter, you better raise the flag and you better get out the bullhorn and you better start yelling, screaming, and shouting. So that's my answer to your question.